Hello and welcome to the series of presentations on the vestibular system. My name is Dr. Jacqueline Gomes and I'm a doctor of physical therapy and a board-certified clinical specialist in neurologic physical therapy. I have been a physical therapist for the past 34 years and for the past 17 years have been specializing in vestibular rehab, and I'm so excited to be presenting to you today on this very important topic: vestibular rehab from a therapist perspective. So what then is vestibular rehab? Well, it is a specialized form of physical therapy for concerns with dizziness and imbalance coming from our vestibular system in our inner ear. And why again is this so important? Well, dizziness is one of the top 3 complaints that a patient might seek medical help for. To understand dizziness better, well, dizziness could be coming from several different causes. It could be coming from medical causes like high blood pressure or uncontrolled blood sugar, or side effects of different medications, or psychological causes like the patient having anxiety. It could also be coming from the person having migraines or a stroke, or it could be coming from peripheral causes like the dizziness coming from our vestibular system in our inner ear. So most of the time with a thorough evaluation, it is possible to be able to discern where the dizziness is coming from, and actually for a significant part of the time, it is ruled to be coming from our inner ear balance system. So a good place to begin would be to understand what we mean by our inner ear balance system. Let's begin with our ear. So our ear has, of course, 3 parts. The outer that we can see, that the doctors can look through and see if there's any redness or swelling or infection or inflammation or drainage. That's all the outer ear up until our eardrum. Then behind that is the bones that help us with our sense of hearing. And then in our inner ear, safe behind this bone, is our balance system. Now our balance system consists of 2 parts. One, as you can see, and we'll talk about this part of it in more detail, and then just closely connected to it is our cochlea. Now the balance system and the cochlea together is just about this little size, like a little coin size that fits in our palm. This, of course, is a model of my right balance system that has just been enlarged for us to understand it better. So one part of it is these rings called semicircular canals, as there's a posterior or horizontal and an anterior semicircular canal. And they're 90-degree plane to each other, such that any direction that I move my head, it sends a signal via these canals to the vestibular nerve, to the brain, and provided both of my systems are working well, I feel balanced in space and I do not feel dizzy. But sometimes if one of them is not working well, then as I turn my head to my right semicircular canals send the signal to my brain that, hey, you've moved to the right. But my left has a hard time being able to tell the brain how far I have moved, and there's a mismatch going from the right to the left, and the person feels dizzy. And at that time, to be able to stop that sense of dizziness, they try to stay focused on an object or try to grab a hold of something to stabilize themselves. And the reason for that is those 2 other systems also do help us with our balance. One is our visual system, our eyes, which we all depend on when it's a brightly lit room and we are awake and upright. But if we tend to over-depend on them, then when we suddenly have to close our eyes, or it's dark, or we turn our head suddenly and our eyes cannot help us as much, that is when a person will feel dizzy. And as that person with that weak balance system tends to over-depend on his eyes, his balance system actually gets weaker, which is called a hypofunction or a decreased functioning in our balance system. Or they might depend on their hands, like hold on to furniture as they walk, or look down as they walk. All of those things help them for the moment, but in the long run is getting their system even weaker and increasing that vestibular hypofunction. So those were the discussion on the rings and their function. But there's another little part, and that's these 2 little sacs in this area here. In those two sacs, there are calcium carbonate crystals, which are microscopic crystals, and it's very important for them to be there because, again, it's because of those crystals that are sitting on our hair cells right there, our vestibular nerve. When we tilt our head in space, or when we move forward or move from sit to stand in an up and down movement, those crystals cause a drag on our nerve cells there, which again sends a signal to the brain, and we know where we are in space. But sometimes, instead of those crystals staying in those sacs, they get knocked out of into one of these rings. And that actually is one of the most common reasons why a person has vertigo or a sense of spinning, is because some of his crystals have gotten knocked out of the sac where they belong into one of these rings. And then what happens is, when a person just tries to lay down in bed or sit up or roll over or even do movements like just looking up or down, since those crystals roll in the ring, it's kind of like sand in a bracelet. It takes a few seconds for it to settle down to gravity, and while that's going on, the person feels very dizzy and the whole entire room spins on him. Then it settles down up until the point that the person sits back up on the bed or rolls back over to the other side, and then the same thing happens and the person has that spinning sensation all over again. It'll be the job of the physical therapist then to find out in which of these rings those crystals have been knocked out of place, and to be able to, with the appropriate maneuver, put them back. So to recap, our balance system has 3 rings and 2 little sacs, all of which in both of our ears, when functioning well, helps us to balance. Because the job of our balance system is to be able to keep our gaze stable while we move our head, so that we can stay focused even while we are moving. And the job also of our balance system is to help us keep our posture, so that our body posture stays stable when we are moving our head in space. Our balance system also has a small role in regulating our blood pressure and our heart rate as we move. Okay, so now that we have some understanding as to what our balance system is, in the next lecture, let's try to talk about some things that could go wrong with our balance system before we then later dwell on some treatments. See you soon.